When we talk about testosterone, most people think of men, bulgy muscles, deep voices, and facial hair. But did you know that testosterone is just as crucial for women's health? And what if I told you that medical science still doesn't really understand what is optimal testosterone levels for women? Let's talk about Sarah. At 42, she's experiencing fatigue, brain fog, decreased sex drive, and mood swings. Her doctor runs a couple tests and says everything is normal, including her testosterone levels. But here's the thing, normal doesn't mean optimal. Unfortunately, there's millions of women like Sarah, falling in the standard reference range for testosterone, but struggling with debilitating symptoms. So today we're going to dive into what I call the testosterone gap, what we know, what we don't know, and why this matters for women's health. This is important. Testosterone is crucial. Now, testosterone is a hormone produced primarily in the ovaries and the adrenal glands in women. Now, women produce about 1/10 the amount as men, and it serves multiple critical functions. Testosterone maintains bone density and muscle mass. It supports cognitive function and mental clarity. It supports motivation. In fact, it's kind of called the get shit done hormone. It boosts energy levels. It enhances sexual desire and response. There are testosterone receptors in the tissue down there that help improve sensitivity and response during sexual relations. And testosterone helps regulate the mood. It maintains skin elasticity. You know that crepey skin? It helps prevent that. Now, here's something surprising. Premenopausal women actually produce 3 times more testosterone than estrogen, and yet we rarely discuss testosterone in women. As women age, particularly during the perimenopause and menopause, testosterone levels declines, and this contributes to a lot of symptoms that can affect quality of life. The testosterone decline has to do with both ovarian and adrenal function. We know that the ovarian production naturally declines as you age, but here's the thing, our crazy modern lifestyle leads the adrenal glands concentrating mainly on a stress hormone called cortisol rather than making testosterone. This is called cortisol steal. It shunts all the hormone precursors down the cortisol pathway, leaving not much to make the androgens that can become testosterone. Now, this is because we would die without cortisol. Without testosterone, you suffer, but you don't necessarily die, and your body is equipped primarily to keep you alive, not necessarily thriving. Okay, so let's say your doctor agrees to test your testosterone level. When you get your results, the lab typically shows a normal range for testosterone that is somewhere between typically 15 to 70 nanograms per deciliter in women, and that's a huge range. Here's the problem. It is the statistical average of the general population, and a lot of these women are already showing symptoms of low testosterone, so they're not basing normal range on optimal levels. I'm here to tell you this. Normal is not the same as optimal, especially when it comes to free testosterone levels. Normal is a statistical equation. So you remember that normal curve from high school math? Doesn't matter if you're evaluating testosterone levels, income levels, height, weight. The law of statistics says the population will distribute itself along a normal curve, and most values are in the middle. The further away you get from average in either direction, the less people have that value. Lab companies take that statistical law and they graph out their values of total testosterone to find the normal curve for testosterone. Whatever value 5% of the population has above that line, that's the upper limit of normal. So with 5% at each end, that means 90% is in the middle, and that's what they call normal range. Ha! How many women in the normal 90% range feel great? And how many have symptoms of low testosterone? Think about it. Most doctors don't check testosterone levels in their patients who feel great. That means that the reference range of the lab is very likely made of women who didn't feel good and had low testosterone. So why don't we have better information about optimal levels of testosterone in women? Unfortunately, the answer points to a broader issue in medical research, and that is that women's health is systematically understudied. Without sufficient research, doctors lack guidelines for things like what constitute optimal testosterone levels across the age range, or how effectively to address symptoms of low testosterone, or when testosterone therapy might be beneficial. And lastly, what delivery methods and dosages are the best for testosterone. So really, there's no lack of agreement and not enough data. There are some medical practitioners who believe that optimal total testosterone ranges in a woman should be 230 nanograms per deciliter. That is significantly higher than the standard reference range. At Vitality Renewal, we want to start a study on our women patients with regard to their symptoms and their testosterone levels, because we want to be able to bring to light more data on what is optimal hormone levels for women. But right now, it's not there. We need to individualize it. We need to look at something more than just what is normal range, and we need to look at how women are feeling. The benefits for women when they have optimal levels is improved bone density. Testosterone is 3 times more powerful than estrogen to stimulate bone laydown. They have better sexual function, better cognitive function, better mental clarity, increased energy, and improved mood, and it can relieve menopausal symptoms. In fact, there are multiple studies showing using testosterone plus an aromatase inhibitor in women with breast cancer have excellent quality of life benefits. Now, the aromatase inhibitor is to prevent the testosterone from becoming estrogen, which is a whole nother topic. But the point is that testosterone can help with menopausal symptoms. The bottom line is this: for many women, optimizing testosterone levels can feel like rediscovering a part of themselves they didn't realize they lost. So if you're experiencing symptoms that might be related to low testosterone, like we've talked about, fatigue, brain fog, low libido, or mood changes, please discuss testing with your doctor. If they blow you off, get another doctor. You deserve to be listened to and not gaslighted. Remember this: standard reference ranges do not represent optimal levels for your individual health. If your levels fall within the normal range, but you're experiencing symptoms, further investigation is warranted. And treatment options should be personalized to your specific needs. You need to be your own advocate. Research, ask questions, and if necessary, seek out doctors who specialize in women's hormone health. We really need to close the gap on women and testosterone. To close this research gap, we need more funding. We need more research. We need clinical studies that focus on optimal ranges. We need better education for healthcare providers. And we need to know better medicines. There are no traditional medicines that give testosterone in women's doses. That's really sad. At Vitality Renewal, we rely either on pellet therapy, which is a hormone pellet implanted into your hip. It can last 6 months. It's great. Or we use a compounded cream because there's no options from traditional pharmacy. Remember this: you deserve to be listened to. You deserve to have healthcare that optimizes your well-being and not just says you're normal. I hope you found this valuable. And if so, please share this with the women in your life. We really need to close the testosterone gap, and we can do this together.